You're watching TVC Breakfast. Now, today is World Sickle Cell Day. It is a day when issues pertaining to the management of the disease are put on the front burner to avert deaths through the condition. Now, sickle cell anemia is a condition that occurs when some red blood cells become deformed and look like sickles, blocking blood flow to the hands and feet. It also destroys the spleen, which helps the body system fight diseases. Presently, Nigeria has the highest number of people living with the condition in the world, meaning that the country needs to step up awareness on sickle cell disease to avert unnecessary deaths and suffering for many. Joining me now via Skype is Dr. Olufunto Kalejaye, consultant physician and clinical hematologist. It's nice to have you join me this morning, Dr. Kalejaye. Now, every year we commemorate World Sickle Cell Day. What, in your assessment, is the impact or the effectiveness of these commemorations if we still have the numbers so high?
Well, today is World Sickle Cell. There's further need to publicize and create awareness about sickle cell disorders. Clearly, there's still need for mass public awareness programs pertaining to this particular day. Cell Day is to create further awareness about sickle cell disorders. So I think we still need to do a bit more regarding that.
All right. Now, when it comes to the precautions, from your engagement with people and your assessment, are young people really taking these into cognizance when they are coming together to settle down together as family?
So that's where mass prevention or mass public awareness anemia. It's very important that we publicize the need for testing for genotype, such that informed decisions are made. We advocate now, I'll also lend my voice to the possibility of even school proprietresses screening preschool children for sickle cell anemia, for hemoglobinopathies or sickle cell anemia, such that the parents are aware of what the children's genotypes are at an early age. We also advocate for this to be done even in primary schools as well as in secondary schools, such that young people are aware of what their genotypes are before, so that they can help in decision making.
All right, as it is. Yeah, Dr. Kalejaye, how you are advocating awareness, but the level, of course, we would say is a good way to go. But how aware are an average Nigerian now, considering that Nigeria has one of the highest numbers around the world?
Well, it's quite clear that we still need further advocacy programs regarding sickle cell anemia. We need to be able to reach out to the grassroots, imploring them at least to get their children tested early. Clearly, we still need to do more because we do have rising numbers of this disorder.
All right, talk to us about the breakthroughs or cure or management or vaccines for sickle cell. What breakthroughs and what research is going on in that regard? Can you tell us anything maybe from within Nigeria or anywhere that in the discipline?
Well, there's lots of research going on, especially outside the country, regarding sickle cell anemia, with the hope for alleviating the disease and even for the hope for a cure. So various drugs are already being used in the treatment for sickle cell anemia in America. Drugs like Endari are available to us at present. There are also drugs that have been used or have been developed to increase the baseline levels of hemoglobin that could help alleviate or the symptoms of sickle cell anemia. This definitive cure for sickle cell anemia is stem cell transplant. present, we do not have any federal government institution that has a functional stem cell transplant center. But I'm sure in the nearest future you would hear, or you'll be made aware of institutions that are going to implement this facility to be available to Nigerians.
All right. Okay, we have to leave you here now. Thank you so much, Dr. Olufunto Kalijaye, consultant physician and clinical hematologist. Thank you for talking to us.